Diabetes mellitus, also referred to as diabetes, describes a lack of response or quantity of insulin in the body. Insulin is a hormone produced by the pancreas, an organ that lies along the small intestine as it exits from the stomach. Insulin allows the body to absorb fats and sugars from the diet. Without insulin, the body cannot process these nutrients and becomes starved. To understand the diabetic condition better, let's look at the body's normal regulation of blood glucose levels. In normal states, blood glucose levels are tightly regulated to ensure an adequate energy supply to all tissues. The two hormones responsible for this careful regulation are glucagon and insulin. Glucagon. Glucagon is released by the A cells of the pancreas in response to low blood sugar. This normally occurs in fasted or stressful states and during exercise. Glucagon stimulates tissues such as the liver to release stored glucose into the bloodstream to return blood sugar levels to normal. Insulin. Insulin has the opposite actions of glucagon. While glucagon pulls energy from storage sites, insulin allows energy to be stored for later times of need. In normal states, B cells from within the pancreas release insulin in response to elevated blood sugar levels after a meal. Insulin causes tissues such as the liver, fat, and muscle to remove glucose from the bloodstream to use for energy storage. Tight control of blood sugar levels is critical for delivery of adequate energy for normal tissue function. Patients with diabetes mellitus are unable to regulate their blood sugar due to a lack of insulin secretion or a lack of tissue response to insulin. Lack of insulin secretion. Patients with pancreatitis or chronic inflammation of the pancreas may develop scarring of the pancreatic tissues. Other patients may develop scarring from immune destruction of the pancreas. The cause for this is unknown. In both situations, this scarring destroys the insulin-producing tissues in the pancreas. So how do you know if your pet has diabetes? Symptoms include excessive thirst, excessive urinations, urinary accidents, and urinary tract infections, voracious appetite with weight loss, cataracts in dogs. Because many different conditions can cause similar symptoms, your veterinarian will need to perform blood and urine tests on your pet to confirm the diagnosis. Your veterinarian will discuss this testing with you in more detail. The good news about diabetes is that it is treatable with a combination of insulin injections, exercise, and diet. For the majority of diabetic patients, insulin therapy is a lifelong treatment. To begin treatment for diabetes, we recommend the following. Insulin. Injections need to be given at the same time each day. Do not change your pet's insulin dose without consulting your veterinarian. When an insulin dose is changed, your pet's body takes 5 to 7 days to adjust. Be sure that your pet eats a normal meal prior to giving insulin. Diet. Cats with diabetes respond best to a low-carbohydrate, higher-protein diet. Dogs respond best to higher fiber diets. Exercise. Regular activity promotes an ideal body weight and keeps muscles strong. Journal. Keeping a journal of daily activities, insulin injection times, appetite, and your pet's behaviors helps identify problems earlier. Your journal notes should also include information on your pet's water consumption. Try to observe how often your pet visits the water bowl and how frequently you are having to refill the bowl. Blood sugar checks. During the initial stages of treatment, we will be checking your pet's blood sugar levels more often until an appropriate insulin dose is found. Your veterinarian will instruct you on testing and monitoring your pet's blood glucose levels at home. Your veterinarian may recommend that you keep a bottle of Karo syrup, honey, or a similar item handy in the event an insulin overdose occurs and your pet's blood glucose drops too low. Good control of diabetes is possible in the majority of patients. There will likely be times when your pet is not under good control. If your pet is no longer well controlled, immediate action is required. Call your veterinarian if you notice any of the following: decrease in appetite, vomiting, diarrhea, return of increased thirst, excessive urinations, urinary accidents, and urinary tract infections, voracious appetite with weight loss, lethargy, weakness, seizures. This is an emergency. We realize that this will be an adjustment for you and your pet. Very soon you will feel comfortable with the injections and how your pet is responding. We are here to answer any questions that you have to make this transition time easier for you.